Today I am going to just talk about the difference between PFM crown, Emax crown and Onlay, and difference between a crown and Onlay. This patient has all the three. This is a PFM crown. You can see the metal here, PFM crown, and this is a Emax crown. This is root canal with composite filling, but we have to cover it now. She has already got root canal done, but covering is not done. And this is an Onlay which I have placed. You can see the Onlay. This is Onlay, and this is an Emax crown which I have placed some years back. This is an Emax crown. Now I'll just tell you what is the difference between an Onlay and a crown. In Onlay, the occlusal covers only the occlusal 1/3 of it, nearly here. You can make out the difference that it is covering only this much. Only this much. You can see the difference here. So 1.5, 1.75 to 2 mm depending upon the function non-function cusp. So we don't cut the periphery of tooth. That means only the top surface is covered and central cavity, and rest of the remaining tooth enamel is there. Now this is a crown, so there is hardly any chance of seepage, because when the saliva drips, it drips down to here. So there is less seepage from underneath the crown or Onlay, because it doesn't stay here. So the chances of secondary caries underneath Onlay is least. In crown, if it is Emax crown, again it is more than Onlay but less than a PFM crown, because Emax Onlay is bonded and PFM crown is cemented. The cement dissolves over a period of time, the resin does not dissolve, and the resin forms a bond, covalent bond, so the water seepage is less. Now whenever we remove the old crown, if the PFM crown is removed, then we always find a decay. Generally PFM crown, a tooth fractures along the crown after 10 to 15 years, because underneath the crown the decay starts. Now this is a tooth which is root canal, but there is no cover. Now if you see, somebody has done a root canal and done a filling here. Okay. Now if I have both options open now, I can just remove this filling without cutting the periphery of tooth. I can simply place an Onlay on top of it, remove the filling, reduce the top surface, put a crown, put an Onlay. Or if I have an option, if patient says no, I want a crown, cheaper option, then I will remove this outer. Center is already hollow, so you are left with only this much of tooth structure which fractures over a period of time. So in Onlay, you are removing only the central cavity. Rest of the tooth which is normal is not cut. In crown, your central cavity is already there. You are filling it and we are cutting it peripherally, so hardly any tooth structure remains and it fractures ultimately. So this is the difference between Onlay and a crown. So Onlays always last longer than crowns.